Dr. Amie Bend, and I wanted to talk about your cervical spine and how it affects how you feel. That being said, I have visual um, slides established here to help guide you through what your spine will do and what it looks like. So your posture is the key to your stability. So when we look at the spine, we often want to see how your posture is because that's the window to what your spine is actually doing. So symptoms that you can have from your cervical spine, or what you know as your neck area, can include the items on this list, which is carpal tunnel, neck pain, tennis elbow, TMJ, shoulder pain, rotator cuff pain, and headaches. So as we proceed with our demonstration, when you have those symptoms, a subluxation of a joint is a term that is used that can affiliate you with the former symptoms. So a subluxation is when one or a group of vertebrae have shifted out of alignment, causing your body to have a misfire or a misfunction. A subluxation of a joint is where a connecting bone is partially out of the joint, and it could be more than one, whereby the body is stretching out the tissue that is encased in the skeletal joint. So that can reduce your nerve flow and make it less efficient. And it can be like a dimmer switch, which turns down, or like a flow of water out of a faucet that flows less. It is something where your body is not communicating through that area as efficiently as it should or could. So here's a demonstration or a visual of the brachial plexus. The nerve flow that comes from the cervical spine is called the brachial plexus and has several nerves that flow from it, the median nerve, the radial nerve, and the ulnar nerve, to name a few. When you have subluxations at the spine, you may have pain that comes from the spine and goes to the nerve endings, causing pain, numbness, tingling, circulation issues, feeling of coldness, no feeling at all, sharpness, all of the above, some of the above. So the cervical roots go to glands and the cervical chain ganglia, and from the face as well as the thyroid. So when people seek chiropractic care, maybe they're coming in for a neck ache or they're coming in for an arm ache, but we will discuss their organs as well because the nerves in the spine are also connecting to the adjacent organ. So for some people, the adjustment process can improve the overall function of the areas where they are subluxated. So chiropractic adjustments and corrections can be very gentle and low force, as demonstrated by my images here, meaning you can have an instrument adjustment where there's no twisting, it's a tapping and it's a tissue adjustment, but it's very, very gentle. Or you can have a hands-on adjustment, and we cater our adjustments in our practice to whatever the patient presents with and whatever their desire is as a patient. So some people are scared and don't want to have a rotation. Some people are injured, they've had surgeries, they've had other areas that make the spine less stable. And so those patients are prime candidates for low force adjustment care, where we use instrumentation to help align the spine. We always use an x-ray before we work on our patients to make sure that we know where their body should be worked on. And we can see if there's any pathology involved so we can determine what would be the best form of chiropractic adjustment. Instrumentation and posture. The posture of the spine affects how well you hold your alignment. So we support each patient by showing them stretches and exercises to support their posture. We also do mirror image or posture adjustments. We will use percussion and stretch to help the body remember the right posture. So if a patient, for instance, comes in with the picture on the right, we will do what's called a mirror image posture adjustment on them using percussion. Of course, you can learn to stretch your spine and correct your postural distortions in addition to getting adjusted. It's just that our unique methods help you reset your posture effectively and efficiently. Research is showing that the cervicogenic headaches are actually corrected by chiropractors. There's many doctors that are realizing that chiropractic care can be very beneficial for headaches. One of them is this Dr. Peter Rothbard, MD in Toronto, and he explains that and acknowledges that many headaches previously thought to be tension headaches or migraines are rooted in the neck. He estimates that about 80% of his patients seen in his large headache clinic in Toronto could be diagnosed with tension headaches, but in fact are cervicogenic pain. And he will often refer patients to chiropractic care if the root of their problem is from their spine. Study in Syracuse University suggests that the headache problem is from the trigeminal nerve, as visualized in this slide here, and it will descend to the upper level of the spinal cord, and this means the nerve flow can be pinched in that area, stemming from a vertebral damage or tension in the neck, and so thereby resulting in pain. So call today if you have any questions for neck issues, headaches. Subscribe to my channel if you like it. Call me if you are local and you'd like me to check you out. I'm Dr. Amie Bend. I hope you enjoyed this video.